各位观众大家好，我们今天准时转播 BC 省新冠疫情，今天是5月20号星期四。这最近的2个月呢，都是星期四呢，不是1点钟开始，就是2点钟开始。2周前呢，他们是在树里，因为树里的疫情比较严重，但是呢，树里在飞沙卫生局的领导下，通过各种各样方法，利用移动的 kiosk， 就是这种注册机到社区，通过社区的一些 leader， 我们转切说领袖吧，号召人，以及宗教界的领袖等等他们进来了。今天是省长，然后厅长，还有为什么省长？因为马上就长周末了希望大家引起重视。
All good? Great, thank you. Good evening, good afternoon, everyone. Premier John Horgan here on the traditional territory of the Wakongan-speaking people, the Esquimalt Songhees First Nation. I'm joined here today for the regular briefing of Dr. Henry and Minister Dix to update on the state of COVID cases and a history of how we got here and what the vaccine program has been able to do for us to this point in time. I'm also very excited to advise that effective yesterday, we have lowered the age for vaccinations to 12, so 12 to 17-year-olds are now available to register to get a booking and get a vaccination. That's good news for families who want to do this together as we increase our immunity in households and communities right across the province. This is an exciting time for us as we see case counts coming down.
那么同时呢，最近的住院人也下降了，新增的人也下降了。我今天呢，今天呢也是给大家重点强调一下，我们的加强执法我们的旅行禁令还是在有效的不是说就是说长周末开始就结束了，长周末结束我们还是旅行禁令。所以我这个猜测是对的，就是怕大家利用这个长周末，天气又好了，开始出去了。所以我们现在还有一段路要走但是我们已经接近胜利了。所以希望大家能够重视引起，不要放松。所以旅行禁令下星期的1、2那么下星期2他说是我们还会来给大家宣布重启初步计划我也希望能够夏天那个秋天能够正常。
Adhering to the restrictions that are in place today,
所以我们目前禁令全一直有效到长周末结束，所以我很有信心，我们的 BC 省会越来越好会有更多更好的长周末希望大家现在暂时做一些小小的牺牲同时也是来保护我们的基础工作者、前线工作人员，所以他们也是希望我们能够每个人遵守生命禁令能够保护他们。
And the success we've had. Dr. Henry is going to lay out some very important information that will highlight for all of us the importance of getting a booking and getting a vaccination. British Columbians from age 12 and up are accessible to this system. We have clinics in communities around British Columbia. It's easy, it's simple, and it'll keep you and your family and your community safe. So with that, I'll ask Dr. Henry to take the microphone, and I look forward to the briefing.
所以好，现在呢就请2位继续做常规的
Thank you very much and good afternoon. I'll start off with an update on our cases here in British Columbia today. Today we have 357 new cases diagnosed with COVID-19, bringing the total number of people with COVID-19 to 140,953 in British Columbia. 80 of the new cases live in the Vancouver Coastal Health Region, 210 in the Fraser Health Region, 12 are people in the Vancouver Island Health Region, 33 people live in Interior Health, and 22 in the Northern Health Region. We currently have 4,636 active cases across the province, 331 of whom are in hospital, 113 in critical care or ICU, and 134,521 people have recovered from their acute illness. Sadly, we continue to have people who die from
COVID-19,
and today we have 3 more of our family members, our friends, our colleagues who have passed away from COVID-19. One in Northern Health, and a person in their 70s, a person again in a long-term care home in their 90s, and 2 people
还有一个是90
in
岁的
Fraser Health
2个是在飞沙一个是
and
80 岁和 60 岁
condolences go
我
to
们
the
的
family
诚挚的哀
members,
悼
the
给
care
那些
providers, and
失
our
去亲人家
communities
庭和
who
朋友
mourn all of the 1,661 people we have lost this
1661个死亡
We have one new outbreak to report
又有一个新增爆发
Carlton Care Home in Fraser Health
也是协助
and
性护理
outbreaks are
院
now over at the Dawson Creek
那么还有一个
and
Dawson
Region
Creek 呢
Hospital
已经
and at
结束
Orchard Haven
所以还是
long-term
3个
So this leaves us with 4 active outbreaks in long-term care
4个长期护理院
and 1 in acute care
一个急诊性诊疗所
It
爆发
has, reporting of outbreaks in assisted living and long-term care homes has been included in our daily reports from the
所
very
以他说
beginning of this,
我们从一开始就给
of
大
this
家汇报
pandemic,
这个
and the information
长期
is
护理院
now
的爆发的
summarized,
情
as you
况
know, in public health reports that come out weekly. The
每个星期
information
都会
is
更新
provided by the leaders in each of our health authority to the BC CDC, and that forms our weekly outbreak report. It has come to my attention in the past week that there are several outbreaks in assisted living that were responded to over the
他
past
说
number of
上个
months
礼
and
拜有几
managed
个协助性护理院的这些爆发的情况引起了我的注意我们的应对有效但是呢没有当时及时的这个汇报就 posted 有2个是在沿岸都所谓的长期护理只要有一例就算爆发
Public health colleagues to manage
所以他说我
those
的同事
facilities,
工会
but they
系
have
统的
not
同
yet
事
been included.
都是
And so,
在积极的这个关注这些
recently,
事
as we
情
became aware of this, we want to make sure that all of these outbreaks are in our outbreak reports, and they will be
所以
added
我们也要
today
确保
for
所有的
transparency.
长期护理院
And
以及
going
新诊
forward,
的爆
we
发
will
都要给
make
大
sure
家
that we include all
汇
of
报给
these
大家
outbreaks in our reports
所以我们
and
的
the
报告
weekly
里边
outbreak
这也是做一
reports.
些小小的
So
更
the
正
exciting news today
那么今天有一
that
个
we
好消息
continue to have growth in our immunization
那么我
program,
们的
and
疫苗
we've
计划
delivered
在顺利的实施
2,687,360 doses of all 3 of our
已
COVID-19
经
vaccines in
268万
BC.
7000多了
And that's a little over
这个
58% of
差一点
adults
点
18 and over in British
58%
Columbia, and about 3% or 138,906 have been second doses.
有 3% 的
I'd
人
like
打
to
了
share
第
a
2针
little bit
了
of information about what that means for us.
那么我也
And
给
this
大
is
家一些告诉一
an
些
infographic
信
that
息
shows what we call vaccine effectiveness.
这个呢
And
就
this
是
is
疫苗的有效性 我也给
aligned
大
with
家
what
解
we
释
shared
一下
last Thursday when we talked about breakthrough and the risk of infection going down when people are immunized. What this looks at is those people in our community who are 70 years of age and over who received a single dose
那么
of
他说我们
Pfizer
这个社
vaccine
区里
mostly.
边一般70岁以上的大多数人还是
How
只
effective does
接
that
受了
mean
1
at a
剂
community level of
那
preventing
么同时
transmission
呢
of
我们的这个
infections?
社区的
And this
免
is
疫的
done
水
using a
平就
very
会提
rigorous
高
process led by Dr. Danuta Skowronski at the BC
因为
CDC,
这个是解释了一下
where
就
we
是
have
说
done
打
this
1
for
针和
many
打
other
第2针的
respiratory
区别打
pathogens,
第1
including
针的话呢
influenza.
大家都打
And
第
we're
1针
now
的
at
话
the
那么
point
社
where
区
we can
的
assess
免疫
the
水平
effect
都
that
会
our
上去
immunization program is having in our community here in
所以这个
BC.
他也是解
And
释
what
一
it
下
shows us
那么
is
到
that
目
our
前为止已
vaccine
经是
program is
268
highly
万
effective.
7000多个人
After
打了
3 to 4
那么
weeks, 21 to 28
基本上
days,
是
with a
59左
single
右
dose,
他
a
说了
person's our risk in our community of transmitting SARS-CoV has been reduced by 70%.
那么
This means we prevent
他说
over 2
下降了
or 3
70%
new infections.
就是
This
说
tells us
传播力
really
下降了
important thing.
70%
Along
也
with
就
the
是说
information
大家
we
只要
presented
打1
last
针
week,
整个
that when
社
we
区的
have
传
this
播
level
率
of
就下降了
protection at a community
70%
level,
所以他说这个
our
很
rates of
重要的
transmission go
也就是
down,
说
our
先
rates
让
of severe illness
社
go
区里
down,
边所有的
and
人
that
先打
protects
第1
our
针
hospital
这样的
system
话
and
呢
protects
传播就
each
会
one
急
of
速
us.
下降
It tells
同
us
时
our
呢这
vaccines
个重症
work.
的爆
But it
发就
also
会很少
reminds us that it takes time
所以
for
这个
these
呢也是
vaccines
提
to
醒
do
我们
what they
还是
need
需要
to
时
do
间
to
让整个社区能够
stimulate our
有一
immune
个
system
提
and
高
for
到
that
免疫
full
的水
protection
平
to come.
所以这
And
个
that
呢
means we need to
我们希
continue
望
to
还要
pay
继续
attention
的 同时要注意各种各样防护在过去的接下来的几个礼拜还是要注意就像我已经打了，但我还是要注意因为你没打不等于就是大家都安全，所以只有等大家都打了，大家都安全了所以在说省长说了今天开始12岁以上的人都可以注册了，12岁以上的人都可以注册了。那么12岁到17岁本省呢，可能有30多万人31万。那么这些呢，他们是都打辉瑞疫苗，大家都讲清楚了，因为只有辉瑞疫苗才取得了这个执照，12岁到17岁孩子的执照。那么同时呢，我们也在看莫德纳现在在做3期试验，数据也很好，那么也在被这个相关的 CDC 在检视。
Whether it's our large immunization sites in some cases, in some more rural or remote communities,
那么同时呢，他也是说到了很多边远地区、农村地区，这个免疫系统都建立起来了。
In some cases, it will be in schools, but we have consulted with public health.
所以同时呢，我们也是和其他的一些同行以及这个取得了一些咨询
for families to go together is to do it through our clinics that we have established around the province.
那么因为那些偏远地区呢是鼓励一个家庭一个家庭来打，也是我们也是跟这些社团里边、社区里边的这个一些代表也沟通过，因为他们这个交通不方便施打不方便，所以呢就可以这个家庭一个家庭来打。那么孩子们的预约呢或者注册呢，如果电话不方便，那么家父母可以帮你注册，或者呢就是这个那个通过电话或者网络那么同时那些怀孕的妇女也是可以赶紧来注册预约同时12岁到17岁的你们已经可以和家庭也可以一起来打。
Or you can, but when you do arrive at the clinic, let people know so that we can have a special stream to make sure that we're able to get you through efficiently.
那么同时呢，如果你是怀孕的话呢，你要给去打的话呢，你要跟工作人员讲，那么工作人员会给你一个单独的通道去做那么我们也是希望能够施打疫苗的地方呢，能够让人们觉得舒服让孩子们觉得不是很紧张，所以
after school clinics there'll be clinics through this weekend that people will be eligible for.
那么同时呢，也是希望就是那些after school 的也可以一个群来打这个我们也欢迎。我记得
And ideally, have your personal health number with you or available.
那么同时呢，希望大家能够带上学校的这个学生证或者是因为中学都有学生证了同时呢自己的这个健康号码
but because they know that it's important to protect.
所以我也很兴奋，因为孩子们能够打的话呢，这样的话每个人家庭里边都能保护起来了所以我们所有所亲爱的人所爱的人都能够有一个美好的将来，我们都可以重新起航，那么大家都可以社交都可以在一起玩一起欢乐那么同时呢，如果大家打了疫苗呢，可以在社交媒体里边分发自己的照片所以我已经看到了这个几百万人大家很兴奋的成千上万的人兴奋的在社交群体里边媒体里边传播照片打疫苗的照片，我们也就看到了年纪轻的人这次全球流行病对他们造成的冲击，所以呢现在呢你们有这个机会来保护自己了，用疫苗来保护自己，所以呢我们已经看到了曙光，所以但是我们还是要提醒大家，希望大家还是能够遵守我们的卫生规范那个旅行禁令还是始终有效。
The information we've presented on how we are managing and the pandemic and the situation we're in right now reinforces.
所以我们现在还是要加强执法，加强对这个监督大家对这个执行我们的这个卫生禁令卫生措施，所以希望大家还是能够本地，然后呢少接触人同时呢
all of the positive momentum that we have gained in these last weeks through the sacrifices, small and great.
所以他说，在过去几个礼拜，大家做出了些个牺牲克服的困难，希望再继续下去，一直到这次周末结束然后我们再考虑如何慢慢开放。我们也是希望能够远远的把这个新冠病毒甩在后面去，我们往前走。我们能够搞好，我们能够统治好、管理好这个自己这个抵抗病毒，保护我们的家庭，保护我们的这个社区。希望大家积极的来注册能够来预约然后呢人群少一点这个聚集的人群少一点那么我们呢慢慢的逐渐的开放我们是希望能够顺顺利利的度过这次全球流行病，所以我也请求大家希望能够居然过去怎么做，现在还是怎么做，希望还是安心那个这个笼让以及呢安全那么同时呢卫生厅长也说一些这个他也是对过去3个人一个是沿岸2个是飞沙一个是70几岁一个60几岁一个80几岁那么同时呢我再给大家汇报一下过去24小时新增357例昨天呢是书面的是超过500在我的印象里边2个礼拜里边5月13号是587 5月17号是443 493 424那么昨天是500多，我记得是500请大家稍等一下，我记得是500超过一点点522但今天是好消息是357了这个也是给大家汇报一下。那么他也是说了331个人在住院，重症监护呢是113都在慢慢下降我看一看那么他同也是说到了这个病床占用率也慢慢下降。好，521例，昨天新增521例那么同时呢，他也是说到了这个3例死亡。那么低于59，差一点点到了59%，也就是268万7千多人已经打了这个疫苗第1针，其中呢3%的人，整个人群的3%的人打了第2针，因为今天已经5月份了，那么1月份4个礼拜4个月，所以1月份打的人现在已经打第2针了，那些老人。那么也是这个卫生厅长也是在做一些总结，也是说的那个长期护理院的困难这个感谢他们的额外的辛苦努力。
And case rates for CHSA, that's Community Health Service Area, and LHA, Local Health Area Level Data, is now ready to launch this afternoon, and it will be launching and live on the BC CDC website before 4:30.
所以今天有一个重大的消息希望家长们引起足够的重视。从今天开始，12岁以上的孩子都可以去注册了。所以他们也是开始从5月18以后又开始慢慢恢复那些非紧急的择期开刀，又慢慢开始恢复了。
As noted, right now we are beginning to see hospitalizations decrease.
他也是说到了这个住院率慢慢下降了，大家都注意到了331了。这个5月13号是413，哇，一下子就低了100了。5月17号就350了。那么重症监护呢，从141到113，也是2个礼拜不到1个礼拜，里边少了几十个。所以这个都是重大利好消息，希望我们一直看到慢慢下降。
No surgeries were postponed in Interior Health, Island Health, Northern Health Authority, or the Provincial Health Services Authority. So from the period April 19th to May 16th, a total of 1,842
所以他现在还是在说到了这个择期开刀恢复的情况。
Just as we bring you up to date, we should note that we have completed very significant surgeries. For example, in the week of May 3rd to 9th, health authorities completed 7,015 surgeries, of which 5,569 were scheduled and 1,445 were unscheduled surgeries. And that is a significant achievement in a pandemic. To have done that, 7,000 surgeries is not far from what we do normally. It reflects the changes we've made, but it also reflects the extraordinary work we've done in our system. But these changes and these limits on the number of surgeries we do continue, and it should send a message given how strongly I feel, and doctors and nurses and health sciences professionals and health authorities and the premiers and Dr. Henry feel about the need to continue to work together to bring down transmission in BC this weekend, that we are not making changes as of today in what we're doing in acute care. It's an important message to everyone that we need to stay the course.
所以他说这个也是重要的消息啊。同时，今天的省长露个面，主要还是警告大家这个一直到下周长周末结束都不会解封，不要大家觉得现在天气好了又是长周末所以这个也是提醒，所以省长出面也是表示一下这个重视当然我觉得我们华人我们亚裔应该是很自觉自律的这些话主要还是说给他们其他族裔的人听所以希望大家来注册来注册来注册啊
If you haven't registered, registered. If you haven't booked, book.
如果84年以后的你们都可以来预约了预约这个 book 是预约不是注册了所以现在44岁或者是哎呦这个话80后都可以来打了44岁今年是21年2021减掉44 1977年还没有80后他说80也可以打了那么所以这个各位听众大家如果是家里有孩子的12岁以上的可以去预约了我这个也是今天看到了其实昨天晚上这个无线电的 News 1130也是提到了这个问题好那么现在呢还是记者提问时间
Thank you Adrian and Dr. Henry and again reinforcing Register, get a booking, get a vaccination. Health orders are in place, travel restrictions are in place until the end of the long weekend. Not the beginning, not Saturday, not Sunday, not Monday, but the end of the long weekend.
所以一定要是长周末结束再说我们如何做那么同时呢注册预约请大家
Please press star 1 to enter the queue. You will be limited to one question and one follow-up only. First question today is from Richard Zussman.
这个省长当的还可以一开始
this is for Premier Morgan. How worried are you about people traveling over the weekend?
他说你认为今年这个长周末你认为有多少担心有很多人突破这个旅行禁令不遵守这个禁令还要出去你有没有多大的顾虑担心
on those who may travel over the weekend.
然后呢你同时有多少信心能够打击这些行为
that whenever we've had a long weekend whether it was Easter whether it was earlier in
他说复活节到现在已
February
经6个礼拜了我们每次发觉长周末以后马上就是新增的数例马上上升2个礼拜以后就新增数字然后呢住院率就上升这个是都有规律每次长周末以后都有这个上升的现象所以我也希望每个省民
to be a gorgeous weekend, certainly on the part of BC that I have the good fortune of living in, and I suspect in many other parts of the province. So stay local, stay close to home. If you have a cottage within your health authority, that of course is absolutely okay by me. But we need to follow the rules until we come out of this circuit breaker. And on Tuesday, Minister Dix, Dr. Henry, and I will be laying out the plan forward. It's a positive plan. People will be excited about it. But let's get through this weekend. It's so critically important. We can't stress enough how important it is to follow the guidelines. Don't look for loopholes. Don't look for ways around it. Find another way to enjoy the weekend and look forward to a fantastic summer.
所以这个不要有找漏洞，不要找漏洞不要钻空子。
One for Dr. Henry and one for Minister Dix. For Dr. Henry, if someone has a family member,
这个西方的这个西方和中国还是完全不一样记者问谁上来你在中国如果上面是习大大会让旁边让位把麦克风让给人家吗不会的所以这个呢这个还是民主社会我们该学的还是要学
comparing staff to residents, obviously much lower for staff. Are you concerned about that, and why do you believe that has happened?
So in terms of the first question, yes, we're trying to make all of our immunization clinics. This is one of the operational things that we've been consulting on over the last couple of weeks since the Pfizer vaccine, or last 10 days or so since the Pfizer vaccine was approved for use in younger children. A parent or a guardian who has an appointment booked for tomorrow and you're 12 to 17, you can go with them.
那么他说，如果父母明天以后有预约的，那你12岁到17岁的孩子都可以去，跟父母一起去了。这个很好，这个很好。他说我们的意愿就是希望能够让更多的孩子们也是尽早打。
Yes, go together.
能够一起来就一起来，很好。他刚才其实说到偏远地区，一个家庭一个家庭去打。
I think the overall take-up in long-term care of vaccination has been excellent.
那么他也是说，这个记者还是问到了，就是这个长期护理院的问题。现在大家听到了死亡还是长期护理院的死亡，这个的确是。那么为什么呢？说实话，70岁以上的也就80%的人打了疫苗，还有20%的没打。那么同时呢，卫生厅长也说了，很多人没有完成第2剂的施打，大家可以记到那么他说从这个3月份以后72%才72%，大家看到了这些老年人不是说老年人不愿意打，有些老年人可能不适合打。
Remember, we'll be doing second doses as we go forward.
所以他说我们马上也会继续第2针的施打。所以只有全省第2针打完，过了2礼拜以后，我看才能够基本上放松了，到明年去年夏天的这个程度。其实 BC 省还不算走在最前面的那个。英国是走在最前面的，所以他们有很多美好的事例，这个我们的先行的一些做法，我们都可以借鉴不管好还是坏。
Some people in those categories who are eligible to be vaccinated, no reason not to be vaccinated, who need to be vaccinated. So we're going to continue to push in all these categories, and I think you're right, Richard. We have to continue to do that.
所以也希望每个到年龄段的人能够去打，就是去打。我也是希望大家能够。他说这个记者叫 Richard 他说也是提得对了，这个长期护理院的问题当然了，还有就是这个其他的社区的人也是。
The impact of vaccination on long-term care on staff and on residents has been profound, continues to be profound, and demonstrates why everybody should register.
资源长期护理希望大家来预约。原来说是注册，现在是预约了啊。
Hello, I'm just wondering, do young people who have registered, do they need to wait for a text inviting them to book, or can they just call to book now? And can you also clarify if kids need a parent's permission to get vaccinated?
他说你要能够澄清一下，是不是孩子们是不是要得到父母的同意才能去打，或者是说他们之前就预约了，是不是要遵守这个预约的？你澄清一下，因为你昨天说了嘛，刚才说跟父母一起去打，那么他说可以按照我们也会给你短消息。
It's called mature minor consent here in British Columbia, and that's part of the Infants Act, and there's no limit to the age that somebody can consent for medical treatment, including immunization.
他说这个关于免疫的问题没有这个父母同意 consent letter， 这个因为我们 BC 省的免疫的这个法律，这个所以这个是该打就打，不是说一定要经过父母同意才打。
Assessing and talking to youth, so we'll make sure that resources are available in all of the clinics.
所以我们也是确保给大家确保那个我们每一个卫生区这个资源都很住院都很丰富。这个那些孩子们都可以有疫苗不需要父母同意你再去打你要打就可以去打但是你要理解，你要能够理解这些症状这个好处还有坏处还有这些症状副作用所以不需要父母同意你就可以去打。
Just following up on what Richard asked there in terms of enforcement, will there be I'm just unclear if we can expect more enforcement this weekend. And also when it comes to the reopening plan, that's going to be unveiled on Tuesday. I'm wondering what level of detail will people see? We see in other jurisdictions they talk about level of vaccination and cases. What can people expect on Tuesday?
那么他说下星期二你们有什么期望？
Well, they can expect on Tuesday that the circuit breaker will be over and a roadmap will be laid out for all British Columbians to see. This is great news for young people who, as Bonnie said, want to get on with their lives. It's great news for entrepreneurs. It's great news for workers. It's great news for adults who want to get on with their lives. And this is what we've been working towards for the past number of weeks, and there'll be an abundant amount of information on Tuesday. We look forward to talking to you about that then. With respect to enforcement of the travel restrictions and the other health orders that Dr. Henry's put in place, that will be as it has been on other days and other weekends. But again, it's critically important that people remember that because the weather is good and the trajectory on case counts is positive, we are not done yet. And I really encourage people to please follow the rules. Don't look for loopholes. Don't try and get around things. Enjoy a good weekend, and then, of course, next week we'll be plotting our way forward together.
所以我们也希望能够一起度过这个难关，度过危机。
First one's to you. Ontario announced their restart program today for details for things that will happen in mid-June. I'm just wondering why you feel British Columbians shouldn't be given that detail now. Are you concerned that they will not hear the details around the fact that they have to wait? Or just trying to get a sense of what the motivation is for holding off until Tuesday.
Well, the motivation is just as you suggested, Justine. It's human nature, and we've seen it in previous situations through the pandemic that when people hear that there's good news on the horizon, they assume that horizon is now, and we need to get through this long weekend. It was thoughtfully put in place. Dr. Henry and her team and the government worked to make sure we put in place a program that was not overly onerous, but would meet the test of reducing transmission, keeping people safe, and keeping as much of our economy open as possible. That's been our course from the beginning. Dr. Henry's approach was not to shut things down, but to find ways that we could operate safely. And for the past 15 months, we've had outstanding results. Mr. Ford and other premiers across the country have had different circumstances. The virus has affected different provinces in different ways. We're confident that the plan that we'll lay out on Tuesday will be a positive one for all British Columbians, whether they're people of faith who are yearning to get back to their temples, to their churches, to their gurdwaras, people who want to get back onto the field and play a game, people who want to travel to their home or their summer homes in other parts of the province. All of that is just around the corner, but it has to be a slow and methodical approach. We're confident that come July we're going to be in a much better place. But on Tuesday, we'll lay out that roadmap, and I think it'll be positively received by the vast majority of British Columbians, and I'm confident that they can wait a few more days.
Justine, do you have a follow-up?
I do, and this one's for Dr. Henry, please. Ontario's talking again today about some potential delays in vaccine supply. They're saying they're going to get 40 million doses instead of 48 million by the end of June. I'm just wondering, with adding 310,000 people to the first dose list, if you could just walk us through a bit of what this means for people who are waiting for their second dose.
Yeah, so we have been obviously looking at the buckets of vaccine that we have been guaranteed to receive and where they fit and the population that we're including at different levels, and that is one of the reasons why we have taken the approach that we have of not introducing the 12 to 17 10 days ago, because we were titrating down the age groups, as you know, and we built in the second dose trajectories as well. And I can say, and I've said this before, we've already moved up to about 13 weeks for everybody, most people, except for the people who received it very early on. But we're now at the point where we have a lot of vaccine coming in the next 6 weeks. So we are moving people up, and we will be looking at moving up, particularly the people that we prioritized in the first wave of this as vaccine came in. So those who are older, who have not yet received their second dose, can expect to be notified very soon. I will say, and I know this is a challenging thing for many people, and I get a lot of questions about this. Early on, we didn't
今天呢，伯尼医生说了，已经3%的人才打了2针，所以这个还是任务很。但是呢，他也是说到了为什么打第1针这么重要，就是因为第1针能够使得整个社区那个免疫力、免疫水平能够提高。
Somebody who was immunized before the middle of April, before April 15th, go on the get vaccinated and register again, even if it's more than
同时呢，也是说到了这个注册的问题。如果你是4月15号以前是打的，还是要请你来注册。注册了之后，我们也会给你尽快的安排第2针。这个你可以打我们电话也好，网上联系也好。
So which is all to say, yes, we expect to be moving everybody up in the order that they were prioritized, which means that people who were on our clinically extremely vulnerable list can expect to receive an invitation. When we had limited vaccine, we spread those groups of people over a number of weeks. Everybody will be eligible within a much shorter period of time in the coming weeks, and we expect that to happen within the next 2 weeks. So this will not delay the moving up of second doses for people who are most at risk, which are elderly in our communities who have not yet received their second dose, for people who are clinically extremely vulnerable.
Camille Baines, Canadian Press.
Hi there, Dr. Henry. Could you please explain the rationale behind not doing the vaccinations in schools where other types of vaccinations are already being done?
为什么你们不要到学校去打的理由是什么？他说我们也是跟其他的一些专家们教育局的这个咨询。
But there's 2 main reasons. One,
有2个原因。
that families want to go together.
那么有些呢是家庭，一个家庭希望一起去打。
That they want their children of different ages to be able to go together, and that
那么
often
因
means
为
that people are in
有些
different
家庭因为
schools.
不是一个孩子，2、3个孩子年
Quite
龄不一
frankly,
样，
most of
那么
our public
家庭
health
都是希
staff
望
is
孩子
still
们一
very
起
much
去打。
engaged with
这个也
the
是对的。
immunization clinics, as well as managing cases and contacts and outbreaks in our pandemic response. So it takes a lot of resources to go into every single school
那
in
么
a
同
very
时呢，
short
他
period
说
of
如
time,
果第2个原因呢，
and
就
that
是
would
如果
not
到
have
每个
been
学校
able
去
to
打的
be
话，
done
会消耗很
equitably
多的
across
资源，分配不过
especially
来。
some of our
我觉
larger
得是
health
对的。那么
authorities,
这个
where
就不
our
考虑了，
clinics
到
are
学校去打就不
established
考
and
虑了
ready。to ramp up
所
to
以希望大家能
have
够
families
自己
come, and
家
we're
庭为单位
taking
去
those
打。
measures to
所
make
以
it
这句
easier
话已
for
经清
families to
楚了，
come
今天
together
再强调
and
一
get
遍。
their
如果
immunization
你
now that
预约
the
了
whole
2星
age
期以
group
后，或者
is
是后天，
eligible.
哪怕是
So
后
that
天
was the decision
但
that
是
we
你只要
made
有孩子
based
了，
on the
你
information
如
that
果
we
后
got
天的
our
话，
BC
孩子们就可以跟你
immunization
去打
committee
了，
and the
不要让
feedback
孩
that
子
we
们
got from
再赶
families
了。
and youth. Having said that, in some communities it will be an all-of-community approach, and in some communities the school is the place where it's more convenient and easy to reach youth. So, and First Nations communities, we've been talking with the First Nations Health Authority about our strategies for going back into First Nations communities for second doses and doing youth at that same time with their first dose. So all of those strategies are going to be used around the province, but we're not doing a solely school-based program for a number of reasons.
策略都不一样，主要目的是让大家更容易来施打。
Yes, I do. Thank you. I'm wondering what kinds of strategies will be in place to remove some barriers, like parents needing to work. Will some of these clinics be open later at night?
那么他说了，孩子们要打，家长们又是上班，你们有没有考虑到延长注射时间？那么有些接种点，那么晚上能不能开？那么他说这个呢是卫生厅长他们也是考虑到了，也是给大家有3小时的时间，这个带薪的。那么同时呢，这个长周末也是开，有些施打的点。 长周末都开这个呢都是给大家有机会。
As you'll know, the legislature unanimously passed legislation by my colleague, presented by my colleague.
他说我们的你也知道，议会也是一致同意这个为了打疫苗的话，给大家带薪去打。 这个都是这个我们整个省一致同意，没有反对。
immunized every day over this long weekend in very significant numbers.
所以这个也是有一个重要的，就是我们这个长周末所有的接种点都开。
into the evening. on weekends. During this long weekend, for example, there are still some appointments, a small number of appointments available, but there will be through the week. So there are lots of opportunities to be immunized, and we're going to expand that and look at the needs and expand that out to the needs of this particular group of people from 12 to 17 over the next couple of weeks. So there is a provision for leave. There's lots of opportunity to be immunized, and we're hoping that everyone takes advantage of that. We've had weeks recently, last week, where I think we had 332,000 available appointments, which were essentially all used, which tells us that we are open for significant times, but we of course are looking to expand that as we increase our supply of vaccine.
那么他也是说到了这个我们的6月份以后疫苗会更多的到货，所以这样的话呢，那个每一个人，特别是辉瑞疫苗都会集中到货所以这个也是好消息。这样的话呢，让会更多的人。
You come back.
I was just going to say that one of our concerns had been Moderna shipments, and
那么同时呢，他也是强调一下莫德纳的到货情况。
We'll have lots of vaccine for the weekend.
他说这个周末又会到很多因为莫德纳又来了。
Hi there. A question about AstraZeneca. I've talked to people in the interior of Kamloops in particular who received their second dose, and I know that there's a pharmacy over here in the island that's giving second doses because they're not allowed to give first anymore, but they had some that I'm understanding were ready to expire. So I'm wondering if you can talk about how many of these second doses are being given out, and does this mean that some of the rest of the people who have their first doses who are now getting past the 4 weeks might be able to get their second dose soon?
So it was a very, very small amount. There were some vials that were already open that had to be used up within a few hours to days. So yes, we said rather than starting somebody anew, use those up on people who had already passed at least 4 to 6 weeks so that they could get start with their second dose. So it's in the less than hundreds, and it was just to make sure that we weren't wasting any vaccine. And as we know, AstraZeneca is a vaccine that's very important globally, and we want to make sure we're using all of the amount that we have.
同时呢，阿斯利康也是在全球很多地方在打这个呢，伯尼医生说过了，那个这个是说过的一个这个问题，就是阿斯利康在其他的国家还是很受欢迎，因为不是所有的国家都像加拿大、美国这样都是有条件的这个也是说因为这个储存呢，其他都是辉瑞啊、莫德纳都有问题，所以阿斯利康呢是给了那个他们很多的好处。
Especially the younger demographics that tend not to, be the first ones to get out there because they're the least at risk.
Yeah, they are the least at risk, but at least in my discussions with youth and what we hear from young people is there's a lot of important incentives for them to get immunized. One of course is as young people, at least once in my life, have a very strong sense of social connection and wanting to make sure that their parents are protected or their grandparents are protected. But also it really is about missing out on life and wanting to get that back and recognizing that this is an important way for us as a community to be able to get back to those social connections that we need and those opportunities that we want and need. So we are hearing that loud and clear. Clearly, young people have questions, as do everybody. There's a lot of people who are not quite sure and looking at what are their friends doing. And I think it's really important that we encourage them to look this up, to go to credible sources of information, the CDC website, to ask questions. And we're providing information that will be much more available for parents, for adults, through our school system, so that we can answer those questions that young people may have about the vaccine. And I think that's really, really important. And then, as we say, removing those barriers. You can go in with a parent or guardian, you can go in after school with your friends. There'll be people who know how to ask you the right questions. You don't have to have your PHN, but you do need to just have some identification so they can help you get through the process. And that's why we're starting. Clearly, we need to we have not reached that plateau so far in British Columbia, and I think that's because we have provided as much information as we can. We're doing better at getting out in different languages and different settings with people, and the partnerships that we have with leaders in communities, faith leaders, First Nations leaders, municipal and regional leaders, these things help. But for youth, I think it really is about them speaking to each other on this. And we've engaged with, as I mentioned, the Youth Advisory Committee at Children's Hospital around immunizations and what are the things that matter most to young people. So yes, we will be putting out more messages and support for young people.
Nick Johansson, Castanet.
This question's for Dr. Henry. One of the restrictions set to expire at the end of the long weekend is the indoor dining ban. Restaurants have been blindsided by some of the orders in the past.
这个周末马上堂食禁令马上要结束了。那么所以你看看这个会不会
Food Services Association requested some notice about lifting the current order,
会不会这个取消
about perishable products and bringing back their employees. Are you able to give any indication to this industry about whether or not they'll be opening their dining rooms in 5 days' time?
Thanks. I'll take that question. The challenges of managing this in a fair way, so all of the people that have been affected by the circuit breaker get information at the same time, is to hold with the position that Dr. Henry, Minister Dix, and I had from the beginning, that the circuit breaker was going to be in effect until midnight on the Monday of the long weekend. Everyone knows that. Everyone heard that. And they've also heard that on Tuesday, Minister Dix, Dr. Henry, and I will be laying out the roadmap going forward. I appreciate there's a whole bunch of different ways to ask the question, but that's the answer. What we'd like to see over the weekend is people taking advantage of an opportunity to perhaps go to one of their favorite restaurants, get a takeout meal, stop in at the immunization center, get vaccinated, enjoy the good weather, and on Tuesday the roadmap will be laid out for all British Columbians to see.
所以他说详细的计划下星期二都会给大家宣布。
Yeah, I guess just that there's obviously some unique circumstances for someone trying to run a business such as a restaurant. Obviously, you couldn't open your indoor dining on no notice, such as a Tuesday afternoon announcement. Is any indication going to be given, not publicly, but to any of these restaurants?
他说我已经知道有些餐厅已经事先得到了一些通知，虽然不是公开的，那么我们现在没有说，他还是玩一些文字游戏。那么他说礼拜二给大家宣布，礼拜二给大家宣布。那么因为主要是室内堂食的禁令，因为主要那个餐饮业这个受到冲击太大。
Aside from the tourism industry, the hospitality sector
他也是说到了这个旅游业、餐厅业受到的打击太大了，他们太困难了。
We understand that.
我们也相当理解。
By and large, the hospitality sector also understands that we have to ensure that we give this information equitably to all British Columbians so they can make the choices that they need to make coming out of the circuit breaker and going into the restart plan, which will be abundantly clear.
这个已经告诉大家一个很重要的信息，就是这个长周末是没有 额外的啊，请大家再
Dr. Bonnie Henry, given what the Premier has just said in confidently stating that the circuit breaker will be lifted come Tuesday. I mean, you had mentioned in the last briefing that we'd have to take a look and see how the numbers were doing right through until the long weekend. Are we just that confident that we're headed in the right direction that we can be so sure to make those statements now and not just come Tuesday?
You know what? All of the things you have the same
这些记者都等不及了啊，都是在说现在这个数据都让你能不能有这个自信，能现在宣布一下。
That things can change quickly. And
那么伯尼斯说了，所有的事情不可能是一蹴而成的啊，只能是慢慢开放的啊。在过去的18个月，
It's not going to be a light switch. It's going to be a dimmer switch.
这个不像他说，这个不是开关一开一关啊，这个是慢慢开，也是慢慢结束。
We know that more and more people in British Columbia are being immunized, and in 3 to 4 weeks, that protection will be maximal for a much greater proportion of our population. So those are the things that we need to think about now. We cannot waste all of the sacrifices that we have done in this last 6 weeks in this circuit breaker. Right now, we have put in a number of additional measures, and we need to follow things through this weekend, and we need to follow through into next week. And then we'll plan, lay out the plan for what the future will hold. But it's not going to be everything at once. It's going to be slowly but surely moving towards the light.
Follow up, Tanya?
Yes, please. And for my colleagues, Mr. Dix, if we could get the answers in French as well for both. Thank you. Yes, as we've seen, case counts have been on a stronger downward trend recently. What do you attribute this to? I mean, these restrictions have largely remained the same since the end of March, except for the non-essential regional travel ban that was added along with the circuit breaker extension a few weeks ago. So what's changed that we're seeing the indicators go down now? You know, has weather been a factor,
we think weather has something to do with it, and we've talked about that a little bit. But really, it takes time. As we know, the case today was exposed as long as 14 days ago. We know that what we're dealing with today is what happened 2 to 3 weeks ago. So it takes that amount of time. Once we put in additional measures, we saw that cases continued to go up for some time. And now, it also, we've seen incremental growth, we see incremental decay as well. Once you hit that certain point where people are taking the measures to stop transmission, so that we're not having as many people exposed for everybody who's infected, then we start to see things go down quite quickly. And that's what we've been seeing finally in this last few weeks. So it really is a combination of fewer people being, more people being protected through immunization, but people taking seriously these the measures that we have in place, not traveling as much, not exposing as many people. The workplace measures that we've heightened have meant that there's fewer transmissions in workplaces, fewer outbreaks in workplaces, fewer opportunities for things to transmit widely in indoor settings like gyms and unfortunately some restaurant and other indoor settings. So these are the things that have made a difference. They're not things that we can stop yet. As we get down and down in cases, it's going to become more and more challenging to reduce them even more. So it's just a matter of okay, now anyway, yes, the short answer is it's because the things that we're doing are stopping us from exposing greater numbers of people, and over time we see that decrease. And thankfully, we're seeing the decrease reflected in the people who end up in hospital and end up in ICU. And those take longer to go up and longer to come down. So we're not out of the woods completely yet. We still are not at the place, for example, when we can restart the surgeries that have been postponed. But that's where we need to get to. So we can't take advantage of the weather to let go of these important measures that we continue for this weekend.
这个只能是希望大家能够持续的 Maybe you can summarize it better in French.
En français, c'est bien ça. Just to say to everyone that tomorrow, Friday, there'll be an update at around 3 o'clock.
明天3点钟书面通知。
A more limited update just to bring
礼拜一的话数字更新有限。
Of the long weekend about where we are with respect to case counts and vaccinations and so on. Je dirais en français que ce qu'on a vu depuis ces dernières 2 semaines surtout, c'est l'effort des gens de la Colombie-Britannique, premièrement, qui ont pris l'action de réduire la transmission de COVID-19. On a eu des mesures importantes, en effet, depuis le mois de novembre, n'est-ce pas? Des mesures importantes qui continuent jusqu'à aujourd'hui et qui va continuer à être là pour le moins jusqu'à mardi prochain et sans doute plus longtemps. Donc, on a ces mesures-là. Donc, on a limité la transmission. Mais il y a aussi, évidemment, l'effet de la vaccination. Maintenant, 59% des gens ont été vaccinés, un peu des adultes, je veux dire, un peu partout en Colombie-Britannique, avec 54% des gens en plus de 12 ans qui ont été vaccinés. Et cela a un effet important aussi. Et le message aujourd'hui, c'est que tout le monde
听不懂这些法语啊，其实也就是重复了一下伯尼医生的话，我估计啊。
Cet effort de vacciner des gens vous protège tout le monde. Vacciner, vacciner, vacciner. Il faut le faire ce week-end et pendant le mois à venir. Cela donne un avantage réel à tout le monde et j'espère que tout le monde va avoir un bon week-end. À mardi, see you Tuesday.
好，那么他说下星期二大家再会，哎，突然之间就没了。本来呢都是说好最后一个问题啊，最后一个问题，现在他们也没有这个话了。好，那么各位观众，我再把今天的数字再给大家简单的复述一下。昨天到今天为止呢是这个24小时里边新增的是357啊，这个是明显显著下降了。那么 BC 省现在的总数呢是到了140953，那么其中呢这个沿岸卫生局新增了80例，飞沙卫生局新增了210例，岛上卫生局新增了12例，北部卫生局新增了22例，内陆卫生局新增了是33例啊，这个也是各个卫生局的分布情况。那么住院呢，现在是331个人住院，显著下降了啊。那么他们也是不否认这个数据。那么重症监护呢也是显著下降，到了113个。那么很遗憾呢。过去的24小时里边新增了3例死亡，那么现在 BC 省总数呢是到了1661个人，到目前昨天为止呢，已经超过了268万7千个省民打了疫苗，其中呢3%的人已经打了2针，那么目前现在 BC 省接种率快接近 59%， 那么从今天开始呢12岁以上的孩子也接受注册，同时呢，如果作为父母明天就有预约打疫苗的，可以把孩子一起带去。政府也鼓励以家庭为单位去接种疫苗。那么各位观众，今天的省长出面主要是告诫大家，这个长周末我们什么都没变，所有的禁令都没变，一直到下周2宣布新的禁令之前都没有变，希望大家能够愉快的、安全的度过一个长周末。这个5月份第4周的周一呢，是每年一次的这个维多利亚节，所以呢，也希望大家能够有一个安全的、愉快的长周末。各位观众，也感谢您观看，也是感谢您对我们节目的支持。我们也祝您周末愉快。